Private health providers are calling on the government to scrutinize the eligibility and capacity of health centers across the country to ensure they can deliver quality services to Nigerians. They also want the government to reduce tax burdens and provide subsidies for electricity and medical supplies. Trust TV's Bitrus Kurutsi has details.
More than 70% of Nigerians depend on private health care services, largely because many believe they offer better quality compared to public hospitals. But private hospitals are battling rising costs of medical consumables, huge spending on power generation, and heavy taxation. Experts have suggested mergers among private hospitals, expansion of the National Health Insurance Scheme to cover more Nigerians, and the establishment of a dedicated health bank to support funding needs within the sector. A healthcare provider, Paul Agbaji, says these burdens threatened the sustainability of private hospitals and urged government intervention.
Cost of manpower, all right, you have to pay. For instance, if you employ a nurse, maybe the teaching hospital or specialist may pay a nurse 120 at the start. Right now, if private paying is such grant, that private will grant it will not grow. The reason is this: because there is no government funding. But in that place, there is government funding. Here is only what you do, what you earn, that you pay your people. So there is need for government to also checkmate this private facility that don't imagine out of recent, because everybody now is a doctor. So we want to have our own facility. Some people, they even treat people in the pharmaceutical stores that are not genuine. All those things, government is supposed to come and check. Are these people, they don't have the capacity to operate?
Some Nigerians share their views on the situation.
The situation that we are in the country right now, we are in the high cost of living. So private hospital must suffer the consequences of that situation that we are due to the tuition. But there is need to come together with the government hospitals to subsidize their payment of the facility.
So to say, call on the private hospital to merge, I don't think it's going to work in this country. But rather will encourage the government actually to do more, by expanding the facilities in the health insurance scheme, and then in addition to that, to pump in more funding to be able to, for the facilities to have more commodities.
If there is anything like source bank and they can go there, it will help them to fund you. Because you collect a loan, they will monitor whatever you are doing. So it's going to be very good. They look at source facilities. They say, okay, we are forcing them to merge together if you want to continue. If you have found one or two that are found wanted, you can force them to merge together if they actually want to continue. That is only on source grant.
Health, they say, is wealth. But for Nigerians who rely on private hospitals for better services, there is growing concern that the economic challenges may soon make quality medical care unaffordable. Bitrus Kurutsi, Trust TV News, Maiduguri.